say when you talk about the popping and stuff that you notice, is it up here or more down here?
Up there.
More up here.
Yeah. Yep.
And that's where it kind of hurts slash pops.
Slash also, I feel like I'm kind of looking at like an up angle almost. Like
it's very crunched together. That's for sure.
Yeah. I hear and feel the crunch.
I feel the crunch too.
Yeah.
Medical term.
Oh, right. Yeah, that area is not so great.
Yeah, I feel a little swelling in here as well. Not a cause for alarm or anything, but it kind of feels like ketchup packet.
Yeah.
Like to tell us. Or what they taught us in school is that edema in the spine feels like a ketchup packet, and it's oddly how much it does. Alright. Now I'm just going to check a little movement here. So just kind of like. Yeah, so.
You know exactly what's happening.
This one's supposed to glide. This one does a little bit, but not as much. Okay? Alright. And the trap.
I also worked them out yesterday, so they're a little sore.
Okay, let's go ahead. Most of your neck musculature does not feel tight to me. I mean, I'm not saying that it's not, but that's a good thing. So it's more so spine related. Okay, we will go ahead and go through these though. Have you ever had active release technique done on you before?
Nope.
Okay. Well, it's a soft tissue therapy kind of made to make muscles move the way they're supposed to, but by actively releasing them. Pin. It's not very enjoyable sometimes.
Yeah, I definitely feel like the ticklishness.
Yeah, it's kind of like a weave. It's not a pin and stretch, but you're holding the muscle down, putting tension in the way that you want it, the muscle fibers to be able to move, I guess, in a healthy way. Probably not explaining that very well, but
kind of like back on track, basically.
Yeah, kind of trying to realign and reprogram the muscle to realize which way it's supposed to move. So see, yours doesn't want to move
no
in this direction at all. So we're gonna kind of slowly tension the other way, and then move the head through the range of motion. Is that not fun?
Yeah. It's feeling a little more relaxed though. So that's good.
It's funny. It works to an extent immediately, but over the next 2 to 3 days, it kind of will continue to work or continue to feel better. Which a lot of people will notice. Like the first day they're in here, they're like, "Well, kind of helped," and then they actually come in after a week. It's like, I feel great. So it's kind of cool how that works.
Yeah. You're definitely hitting whatever pressure point it's irritated by. I can feel it.
Yours is some of your trap, but it's also your levator scap. And a lot of people think when they have this big knot right here that it's just a knot in their trap.
Yeah,
but actually that's where the trap and the levator scap cross. So the levator scap is a skinny little muscle, but it crosses right under the trap, and that's this little point here.
Gotcha.
But everybody's like, I got a huge knot, and it's kind of both of those muscles being tense, but where they cross is the real problem, so they kind of get stuck together. And the two muscles, you stretch them halfway the same way. So you would look down to stretch. You notice how your shoulders kind of come up when you look down? That is why I know levator scap and trap, but levator scap is involved because your levator scap comes up here and it attaches to the top of your shoulder blades. So your shoulder blades are following your neck as soon as you look forwards every time. When you look up, when you look back up, they relax. Then when you look forwards, your shoulders
kind of move with it versus like being back here, I guess, and kind of.
They just kind of. Our goal is to have our shoulder blades back and down, not necessarily jammed back together, but just down. And yours cannot stay down and you look forwards. You can't.
Yeah, I'm like constantly correcting my posture when I'm standing because I notice I'll start going like this if I'm like looking down, so I'll like overcorrect kind of to like.
Next time when you're doing it, think about, instead of thinking about pulling them together, I want you to think just pushing them down. So just back down instead of like pulling them up here, because that's still kind of contracting the muscles a little bit.
Gotcha.
When you pull them up, because that's part of the levator scap's job. It elevates the scapula.
Okay.
It's weird how all these muscles have what they do in their name sometimes.
That helps when there's so many. I can forget which one.
Oh yeah. Especially in the hand and the feet.
Oh yeah. A lot of tendons there.
A whole bunch going on.
Yeah, one time I had a sports evaluation probably like 5 or 6 years ago, and they kept telling me that my right shoulder was like higher than my left shoulder, and I think I've just had that problem for like forever.
Yeah, are you right hand dominant?
Mm-hmm.
Probably just from, a lot of people are that way, I'm that way as well.
Kind of just whatever side you work the most.
Yeah, the muscles kind of get overdeveloped, or you just get used to doing things with that arm, so it's not necessarily a bad thing unless it's painful to you. A lot of things, if they're not painful, I'm like, well, we're not gonna mess with it right now.
Yeah, because it might, make it
We
painful.
don't want to make whatever's painful. If it's working, then good.
Definitely. Okay, just get a lot of soreness, but that makes sense. That this has like always been my problem area.
Yeah.
So makes sense. Are there any like exercises I should like avoid maybe, or maybe even that would help?
Yes, there are. We will get to that.
Skipping ahead. Sorry.
After this, I'll show you a couple stretches and exercises to kind of help you train to keep, like, whenever you warm up for exercising or anything like that, which it's also something you would do every day, but it's good when you're warming up to kind of retrain your body to where it keeps the shoulder blades down naturally. Another thing I want to kind of test when it relates to when we have scapular problems like that, so put your hand in a fist like this, and I want you to punch up towards the ceiling against resistance here. Okay, strong on that side. Let's try this one. So straight up and punch. Good. So then that's not it. Serratus anterior is a muscle, that's what that action does, but it also keeps your scapulas glued to your rib cage.
Okay.
So that's kind of how we test to see if that's what's weak and making the scapula kind of flare around and do crazy stuff. But
gosh, see which angle it's not.
Yeah.
Yeah.
Another thing we could test to kind of find out. It can come from that serratus anterior being weak and it letting the scapulas flare out, or you having a weak, deep cervical neck flexors, which is making this have to hold your head up all the time. So we can also test that. I'm gonna have you tuck your chin. Okay, a little bit less. Perfect. And now I'm gonna have you lift your head off the table just this much. See how we kind of gradually, your chin's coming out, and it kind of feels, that feel hard to you?
A little bit.
Okay, come back down. Tuck again. Perfect. Now lift and hold. Yeah.
A little bit of strain.
A little strain, yeah.
Yeah.
So that's probably more so what the cause is. When your deep cervical neck flexors get weak, which most people's are, it's like an upper cross syndrome kind of thing. It's kind of like this isn't holding your head up all the time, and whenever you're doing things, they're not strong enough to support your neck and your head. So your trap and levator scap, that all attach at the top of your head, or at the bottom of your skull, but top of your neck is what's holding your head up all the time. So they just continuously getting tense. So that's probably more so what's going on.
I wonder if like looking down like at your phone kind of thing weakens that area.
It does.
Yeah.
Definitely does.
That's definitely like a sensitive area.
Yeah. 4 tiny little muscles in here. Your suboccipital muscles. And when they get tight, they can cause a lot of the issues that you're talking about. And they kind of, when you're saying it feels like you're always kind of looking up, when those are tight, they kind of push your chin out like that and they jam the back of your head together.
Yeah.
Not the whole back of your head, but you're just
kind of
C1,
upper,
C2,
yeah.
But yeah. They also cause headaches. Do you have any headaches? Okay,
for sure.
that makes a little bit of sense then.
Yeah.
All the trigger points in these muscles referral patterns, which are kind of like just a referred pain when they're tight or irritated, mimic like headaches that come around here, anything like that. Is that how
Yeah, kind of like a tension headache.
Yeah,
for
exactly.
sure. Definitely more towards like the end of the day too, so that makes sense. Like straining from the day kind of thing.
Try to relax. You also have very tight SCMs in the front of your neck. So sternocleidomastoid muscles, they are these big guys right here, this chunky piece.
The one that kind of like
they attach right up here, and go right down to your sternum. But yours are extremely unhappy.
Honestly, how do we cheer them up?
A little bit. I'll give you a stretch for that too. Start taking notes because we got a lot. Alright, tuck your chin for me.
Yeah, that's a good one.
I haven't even released SCN yet, so that's gonna be fun.
No.
Might need to do that too. So it'll stop trying to overpower me in here. A lot of times when it's tight and it kind of feels like the patient won't let you hold their head.
Yeah, that's the thing.
And
My problem.
it's
Even when I'm trying, it's still
yeah,
just
it's like
fighting
you
it.
can't help it. There's literally nothing that you can do.
That makes you feel better.
Yeah, no,
Yeah,
that's kind of like a cue that like they can't if you have to tell them a couple times.
I heard a pop. That was good.
Yes, that's good pop. That means
Yeah.
things are moving that weren't able to move.
It wasn't like the pop from before.
Yeah. And a lot of it could be that because all these muscles attach to places that are right around or on the place that you're saying keeps popping.
That makes sense.
And it could be that these these muscles are so tight that they're pulling it out of where it wants to be. And not that the pops are a bad thing, but it's kind of like a sign that it keeps moving around.
Yeah.
Alright, so we're gonna do some adjusting. Alright, so now with your eyes, I want you to look up and to the right. Take a big deep breath in. And all the way out. Relax. We're gonna let you breathe for a sec. You were really tense and I didn't want to thrust through it.
No,
So
you're
relax.
good. This kind of freaks me out, I feel like.
We can do it other ways. Good? Okay. Do one more time, and if not, then we'll. Alright, look up and to the right with your eyes. Okay. Yours are pretty crunched together, they're not going to make the big kaboom. But this whole left side is pretty locked up. We'll go a little lower.
Same thing?
And just breathe. Wiggle your toes.
That was a big snap.
You're one of the ones where we have to give 85 different things to distract you, and then you will relax.
It's funny, I'm like super easily distracted, but when I don't want to be distracted, it's impossible to distract me.
Now we'll go a little lower on this right side, because the lower part over here is a little worse.
Yeah, definitely. Yeah, that one was, yeah.
Yeah, I've got a little tension here. Alright. Big deep breath in. And all the way down. A little bit. There we go. That one's locking up.
Yeah.
Now let's do
It's
that
one of those
again.
I gotta fight it things.
Yeah. A little better.
Yeah.
Yeah, your scapulas are pretty snug in there. Feel some tension in the front of your legs on this. I think you might have extremely tight quads.
You know, that's probably accurate.
Yeah. Calves are okay, so we're gonna do this since we saw our.
Oh man.
Yeah, that's really rough.
Yeah, that's pretty bad.
So this is making your squat.
Ooh.
This is a part of it not being enjoyable sometimes. Promise it helps. Work through the pain.
Yeah, no pain, no gain.
This was part of the reason your squat went down a lot further when we put your heels on that.
So what'd you say was going on with that area? So the ankle mobility.
Ankle mobility,
so
a lot of times,
like,
yeah, when your calves are super tight, they'll just restrict your ankle from the back. So we're gonna check out the front once we turn you around. But clearly we have some things happening here. Yeah. Clearly we got a couple things going on.
That was the ankle I was saying. It's been like very messed up my whole life anyway, so that's probably just thrown everything off like for a long time. But
everybody has one of those ankles, I think.
It was better for a few years, and then I decided to run cross country and screwed it up. So yeah. Too many ankle rolls.
That'll do it.
I do not run anymore, so that's good at least.
Yeah.
This side isn't as bad as the other one. I mean, I still feel it a lot, but the other one was like excruciating.
And it's mostly the outsides of your calves that are the worst part.
So
we'll do some of those when you're flipped over. I'm gonna have you flip on your back now. Yeah.
Super tight. I always get pain right in there in my feet.
And a lot of it, if you notice, whenever I push your feet up, your knees come in.
I'm a little bow-legged. I don't know if that's related.
If it's been like that your whole life, then that's fine.
Yeah. My parents used to make fun of me for being bow-legged all the time. It wasn't like I needed like a brace or something like that. But
yeah.
I'm a little naturally pigeon-toed, I guess.
So the arch support will help with that a lot. So especially with during your movements and whatnot.
Yeah. You think I should maybe just be using them in like my workout shoes, I guess?
Yeah.
The thing with squats though is I'll usually squat barefoot. Do you think I should?
Ooh. Sorry. Had to do it. There we go.
That was a good one. I just was not expecting it.
The toes are always the fun surprise. Yeah. So the outside of over here is where I was talking about being super tight.
Yeah.
There's
I feel it connecting like all the way down to my ankle now.
Yeah.
Yeah. I like literally feel the whole like
These usually get really tight in people who do have flat arches. These are your peroneal muscles. Because whenever this collapses, it kind of brings these close together, so they're constantly tight, or they're constantly in a shortened position, and they just get contracted and they stay that way.
That makes sense.
A lot of times inside of the foot can get tight.
Ooh, yeah, I've never even noticed that before, but new areas of tension.
People are always like, that didn't hurt before you pushed on it.
I know, right?
Well, sorry.
It probably was hurting some other way.
That's why you came here.
Bring a whole bird.
As we call these the torture rooms.
Great.
Yeah, so we have a quad problem. Add quad stretch to the list. This is probably
Why does it hurt so bad?
your main one. People don't know how to really stretch them. Like
That's my
most
thing. I
people
need
would
to
stretch quads
more.
like this.
Yeah.
Doesn't really do very much. So I'll show you one that's a lot better. Getting the whole muscle.
Oh man. I'm like sweating the pain out now.
Yeah.
Sheesh.
That also happens. People like are really drenched in sweat.
This is my
Like,
workout
what do you
for
mean?
the
I'm
day.
cold.
I'm trying.
It's me right now.
No, this is great. I love it. Oh my god.
this one. Hold your leg straight. Okay, just hold your leg out straight.
Okay.
Like this. There we go.
Okay.
And bend it.
Bend it?
Mm-hmm. As far as you can. Everybody there we go. Alright, begin.
Again.
Yep, and bend. There we go. Alright. Okay. Let's do turn on. We do need to go through some glute stuff. I don't want to know if I want to torture you that much. Because we've already got it.
Oh no.
Yeah. Because it wouldn't be fun.
I definitely got tight hip action, so yeah.
I feel like I hear her complain about her SI joint a lot.
Yeah. I get like weird sciatica. Like, oh!
And
that one on
silence. Alright, let's do one more. And you're short. That's why that one was weird. There we go. Now we got it.
That was a little looser.
That was better. Alright, hop up. I won't torture you anymore.